Hey everybody, welcome back to the channel for another video today. Happy Thursday. I hope you're having a great week so far. You may have noticed that I did not post a video yesterday on Wednesday, and that is because my sister had her baby. So if you've been around and you know that I nanny my niece, or I've had nannied, not anymore, but was nannying my niece, her mom has been pregnant and she had her baby on Wednesday, yesterday. So she had a little girl, they named her Olive, and she is beautiful. And so we've just been like basking in new baby. It's fun to like be able to see a newborn and hold a newborn and snuggle a newborn, but it not be my newborn, you know? So yeah, that's where I was yesterday. It's probably where I am right now if you're watching this video, snuggling a baby. And yeah, everybody tell my sister congratulations in the comments. I'm sure she would love to see some congratulations. But today we are actually going to be talking about some positive benefits of GLP-1 therapy that are more focused on health in terms of like what goes on the inside of your body when you take a GLP-1. And this is not information that it's a little different than how I normally do things, because it's not information that I just like pulled out of nowhere or that I researched myself or anything. This is actually information that my doctor provided to me. So I kind of went to him and I was like, yo, I didn't say yo, but I was like, hey, what can I offer people if I was going to be telling somebody who wanted to know deeper what these medicines could do, what would I tell them? So he actually broke it up for me into 4 different bodily systems and bodily functions, like the metabolic benefits, the cardiovascular benefits, the neurological benefits, stuff like that, so that I could categorize it and share with you guys exactly what GLP-1s can do in all different areas of your body. So I'm really excited to share this information with you guys today. I saw him about a week and a half ago for my checkup. I had blood work done. I'm still waiting on a couple of those results. And so once I do, we'll share like my yearly blood work update or whatever that I usually do. But yeah, I'm really excited about this. We are just going to go ahead and jump right on into it. As always, I am not a doctor. And so if you have any questions regarding your dosage or what medication you're on or anything regarding your personal treatment plan, please make sure you reach out to your provider and don't take information from anybody just off of the internet. So let's go ahead without further ado and jump right on into it. So like I said, he broke it up into 4 different areas for me. We're going to talk metabolic, cardiovascular, neurological, and liver and inflammation benefits. And some of these I had not heard of before. And so I think that it's really cool that I was able to obtain this information. I do have my notes right here and I don't have my glasses on because of the glare. So if you see me looking down and maybe squinting a little bit, you know why. Okay, so we're going to start with metabolic benefits. So first off, we know this one, it controls cravings. So that translates to less food noise. You feel like you're more in control of your choices. And he said that typically that does happen rather quickly. So even on the 2.5 dosage, a lot of people will experience a lower level of cravings and a lower level of food obsession than they had prior to starting the medication. We also have improves insulin sensitivity. So within that, he clarified that what happens is your body gets better at using insulin. So it ends up not only, producing the right amount that your body needs and helps with that, which is why we know that it can help treat type 2 diabetes, but it also helps your body to use it effectively. So this is actually really transformative for pre-diabetics or people with PCOS, which we know that I've mentioned that in a video a couple of days ago, that PCOS has been a huge topic of conversation in terms of GLP-1s right now. And so he said this is why, that your body gets better at using the insulin that it produces. It lowers your blood sugar, it improves your A1C levels, which translate into lower sugar crashes. So even if somebody that wasn't on a GLP-1 and somebody that was on a GLP-1, say you both drink a large Mountain Dew, a large full sugared Mountain Dew, the person not on a GLP-1 is going to have more out of control sugars, more out of control A1C, and they are going to experience a bigger sugar crash than somebody who was on a GLP-1 with controlled sugars and all of that. So again, super beneficial to pre-diabetics and diabetics also. But even if you're not a diabetic and your insulin does what it's supposed to or whatever, when you take in a huge abnormal amount of sugar, your body reacts to that in some way. So it takes the crashing off the table in terms of that. It targets visceral fat, which is one that I necessarily was not familiar with. So visceral fat, a very good example of visceral fat is your stomach, which is why they always say that people with a bigger waist circumference have a higher risk of like heart disease, heart attack, stroke, all of those things, because your stomach is visceral fat. This is something that I had not heard of, and I don't know if this is a newer thing. If you have heard this, please let me know in the comment section down below. I would love to discuss this. I don't have any visceral fat. Most of you know that. I had it all cut off. There ain't nothing there. I had a tummy tuck actually before my GLP-1 journey started. So even when I started a GLP-1, I had very little visceral fat cells in my stomach because there just, again, wasn't anything there. But so I can't attest personally if it had this great effect on my stomach fat, but I want to know if it has on yours, because again, that's something that I had not heard of before. Lowers inflammation all over the body. And this is a topic that we're going to discuss within the 3 other targets as well, more specific to those functions, but it lowers inflammation everywhere, which just improves the way your body works in every facet. And that's just really cool. And then it can improve your cholesterol. And he said the big thing is that what they're seeing is that it takes somebody with even with good cholesterol, and say your good cholesterol was lower, they want your good cholesterol higher and then your bad cholesterol lower. He said that even people with average cholesterol, you start to see their good cholesterol trending in the right direction, going up once GLP-1 therapy is established, which again is really cool. Moving on to cardiovascular benefits. A lot of these we've heard of, I think, but one thing that kind of was put in the forefront of my mind with this was there was one thing that was definitely like brought up and I was like, oh, that makes total sense. So first off, lower blood pressure. Okay. This can be, he noted, like in parentheses, was with or without being a diabetic, or with or without weight loss. So it's lowering blood pressure in people that aren't even having significant weight loss, which is overall a better thing for our health. So again, super cool. Reducing the risk of heart attacks and strokes. This has been proven in clinical trials. That is why Wegovy in particular is prescribed by a lot of cardiologists for that reason. And so this is one that everybody sort of knows. Your heart attack and stroke risk are lower if you are taking a GLP-1. Again, so super cool, right? Lowering inflammation in your arteries. So this is the one that when it was said, when I read it, I was like, oh, that totally makes sense. So healthier blood vessels, meaning better circulation, meaning again, your body functions better overall. Again, so cool, right? So if the GLP-1 is helping to reduce inflammation everywhere in your body, then your blood vessels are less inflamed, they're more open, blood is flowing more freely, you're getting better circulation all over your body, and then your whole body is functioning better. So again, so cool. We should count how many times I say super cool in this video. Helps prevent heart failure, in particular to type 2 diabetics. Super cool. Okay, moving on to neurological things or positive side effects. So the first one that was mentioned was clearer thinking, less brain fog. I mentioned this one a couple of weeks ago in a video that sort of remove, and I think I don't know, again, not a doctor, but I think it has a lot to do with removing the food noise aspect. And so you just have more space in your brain to think more clearly. But clearer thinking, less brain fog, more focus is a positive side effect of GLP-1. Mood stability. So you have fewer crashes. We're talking about those sugar crashes a few minutes ago. So you're having less mood crashes overall. People report lower anxiety levels. And so mood disorders are actually one I've mentioned a couple of times recently, that there are over 42 health ailments that are currently being studied for use of GLP-1, meaning 42 different things that they're trying to figure out if GLP-1s can help and are showing promise for helping these different things. Mood disorders are one of them. So mental things are a big part of a lot of the studies studies that are going on right now. So this one wasn't necessarily surprising. And going along with that, with the same study type of thing, reduced urges. So there are current studies going on for alcohol, nicotine, and food addiction, and I believe gambling as well, but that one was not mentioned. But pretty much the addiction center of your brain, they say that GLP-1s have the ability to essentially just turn that off. And again, it makes sense if it's turning off the food noise, food addiction center in our brain, then it would make sense that people would be able to handle other addictions better, whether it be nicotine or alcohol or shopping or anything. I mean, you can be addicted to like anything, right? So I think that study, that's one of the, I'm interested in several of them. Another one that I'm interested in is the breast cancer one that's going on right now. And like that it's been proven to help to shrink a specific type of breast cancer tumor. But this one is another one that I would really be interested in as a child of a gambler. My father was a gambler, and I think I might have mentioned that in my story thing, but I had a father who was a gambler, a mother who, if she was being honest, had a shopping addiction. And then, you know, of their 6 children, four of them have been habitually overweight and struggled with food addiction. So it's quite interesting how that transforms along generations too. So that study in particular will be one that I really would be interested in learning about. Better sleep. We know, I've mentioned this. This is what is reported. This is not what my personal experience has been. But the thought is that less inflammation all over your body and steady blood sugars help to provide you with a deeper, more restful sleep. That has not been the case for me. In the entire journey that I've been on my GLP-1, I always have trouble sleeping, especially the first couple of nights after my injection. And that's just how it's been for me. But there are a very large number of people who report that they sleep better since starting GLP-1 therapy. So take that with a grain of salt. There's always going to be outliers in any sort of statistic. I happen to be an outlier in this one. Brain protection. So this is another one that I've actually been reading about over the past couple of days, the breast cancer one and this one. I've been reading about both of these. So this one indicates, early studies have indicated that GLP-1 use reduces the risk of developing Alzheimer's or Parkinson's disease, which are two obviously brain conditions that are terminal and that there is no cure for. And that is like, if you have ever seen or known somebody with Alzheimer's, I personally have not known anybody with Parkinson's, but I have known Alzheimer's patients. When I was in college, I actually worked in a nursing home on an Alzheimer's unit for a very short amount of time because quite frankly, I did, to work in healthcare, you have to have a heart for whatever area of healthcare you're working for, right? That was not where my heart was. I really struggled in that setting, and I've always been able to, I have really good discernment. And so I was able to step away and say, okay, this is not for me, and it's not for them if it's not for me. Like, me being here is not also for them, right? So I stepped away from that, but it was the hardest thing to have to sit and see people know who you were one day, have zero clue who you are, know their children one day and then not know their children. So to think that something that has never had any type of cure or treatment for might, again, it wouldn't be a treatment, it would be a potential prevention, but still, like, that's just absolutely amazing, I think. Moving on to the last category, which is liver and inflammation benefits. So the first one is improving fatty liver. This is one that people have asked me about a lot, if I had heard anything about it. And this is one that I have not done a ton of research into. So if you have, again, leave your comments down below. But essentially it lowers insulin resistance, promotes weight loss, and reduces liver enzymes, which translate into improving overall your fatty liver disease. If you are somebody that struggles with that and you have noticed an improvement in it, I would love to hear about it. If I'm being 100% honest, I'm not even really sure what fatty liver disease is or entails or how it comes about. Like, that is something that I would really have to go deep dive into and research, which I'm definitely not against doing. You guys know that. But apparently that's a really big positive for the GLP-1 community or for people who struggle with that. Another one is inflammation. Again, we're talking inflammation consistently throughout this video. So like obviously inflammation is a huge thing that we struggle with in many other areas of our body, and can be calmed with GLP-1 therapy. So in terms of the liver, you have inflammation, like joint pain and fatigues. If you're somebody that has like rheumatoid arthritis, there's a lot of people reporting that it has helped with their aches and pains associated with that. So if you are somebody that struggles with different types of arthritis, just reducing, because what that is inflammation around different joints, right? So if you, I wonder if, is carpal tunnel a form of arthritis? I'm not sure, but carpal tunnel is actually something that I struggled with after with my second and third pregnancies. And then after Finley, my last baby, I had carpal tunnel until I lost weight. Like I had to wear a wrist thing. But was it the weight loss or was it the GLP-1? So I don't know. That's quite interesting. Mine would always come at night. Again, I don't even know if carpal tunnel is a arthritis type thing, but joint pain, inflammation of your joints, you lower your inflammation in your body, your joints are going to feel better. So again, super cool. And then blood vessel inflammation, which we talked about in cardiovascular, I think as well. Like I feel like that was lowering inflammation in your arteries, but we also are lowering inflammation in our blood vessels, which improves your blood vessel. You lower risks of things like plaque and stiffness. So if you're reducing inflammation in your blood vessels, then again, everything is flowing more freely. And then I guess maybe the thought is there wouldn't be as much plaque buildup. Again, quite interesting. There are several of these, that being one of them, that I'm like starring as I'm talking to you guys, that I want to look further into. So the Parkinson's, Alzheimer's is one, the fatty liver disease is one, this is one. If there's another one that you want me to kind of deep dive into and maybe talk more about, I would love the visceral fat for sure is one. I would love to do that because I think that is just so cool. I think the overall inflammatory benefits make sense. But things like reducing the risk of plaque in your arteries and your blood vessels is pretty cool. Like the more that comes out about GLP-1s, the more I'm like, why is anybody against these, right? It's just, I had a comment on a TikTok actually the other day talking about don't do it, but I mean, they probably don't know that I've already done it, but like, don't do it. You don't know what's going to happen in 10 years. I'm like, yeah, but like all of the risks of being obese and all the things that could come from that are so much worse than the potential side effects of a GLP-1. Like, it's just absolutely insane to me that people would stay 100 pounds overweight or whatever for fear of possible side effects, when if you're obese, we know like it's gonna happen. Like you're gonna develop some of these ailments. Like it's gonna happen. It's like almost 100% chance that you're gonna end up with some type of health issue. So it's just crazy that like people are still against it. But anyway, I hope that you enjoyed this video. If you did, please don't forget to give it a thumbs up. Join in on the discussion down below as well, or in the free encouragement Facebook group. It is always linked right below Orderly Meds. I'm pretty sure. They're right next to each other, so you should be able to find both of them if you so need them. Thank you guys so much for watching today's video, and I will probably see you on Monday for a weekly update from the beach, because we will actually be at the beach next week. We decided to take a little, not the whole week, but a little bit of an extra vacation this year. So we're going to the beach in a couple of days, and we're gonna hang out there for, do some back to school shopping type of thing. So my update should come from the beach this week. And yeah, thank you guys so much for watching, and I will see you guys in the next one. Have a great day, guys. Bye.